You have accomplished a lot as a healthcare professional, nurse practitioner, and entrepreneur. When did you first realize that being clinically qualified was not the same thing as being prepared to own and lead a healthcare business?
All right, as a nurse practitioner, actually, my goal is to care for people.
Mm-hmm.
I know the answer seems generic. However, I genuinely care for my patients. So at some point during my career, I realized that spending 15 minutes with my patients is not quite enough. I needed more time to spend with my patients. So that's one. Another reason, the point that I realized was when I witnessed a patient being turned back because they couldn't afford to pay for their visit because they didn't have insurance. And I was like, not having access to care is not the best. And another reason is being a teacher. I love to teach. So where I used to work, I get to teach nurse practitioner students, right? But usually allowed maybe once a year. And there were so many other NPs that I really needed that service. And I figured, if I don't start my own business, there's no way to actually be able to take care of these people. I know they were actually looking out for me at the time. They don't want me to get burned out and I truly appreciate that. Because even as of now, I don't always take students all the time. It depends on what's going on. But at that point, I realized that something needed to be done. And then that was what really forwarded my passion in starting my own career so I can actually do things the way I really know how to care for patients. And that doesn't necessarily mean that I will get to the point where we still have to balance things. You have to keep your doors open. I'm not going to be in a room with a patient for 2 hours, obviously, because at the end of the day, that's not even beneficial to both of us. But I do it to the point where at least I spend some good time with my patients, not only looking at what they're in for. I go beyond the diagnosis, beyond the prescription, and just want to see the whole person. They come in for one thing, and then I'm like, what else is going on with you? Why is your blood pressure elevated? Maybe they didn't sleep well, or maybe there's issues going on in their lives, family issues, just stressors that could be causing high blood pressure. I want to take care of the whole thing, not just one thing. So I feel like having my business and having my career set up and getting this business really gives me the opportunity to really take care of people like I want to.
So, now that you are in, private practice, like what's that one thing that you had to learn about business, about leadership, and even ownership that, you were never taught during the time you were, in education?
Yes, so just focusing on the business aspect of it, the reimbursements. With insurance companies, it's a big deal.
Really?
I had to learn that the amount you get reimbursed is not always equal the time you spend with the patients. It doesn't equal. It doesn't fit. Most times.
Well, then stop right there. Then that explains why these MDs are moving.
Yes,
so. but it sounds like for you, yes, it's about money because you have to keep your practice alive, keep it open.
Yes.
But I think your mission is the mission of the people.
Yes. Yes. So this is it is actually more of a mission for me than just. Of course, we have to keep the practice open, but at the same time, I do it because like I said earlier on, I genuinely care for my patients. I want to make sure they get the care that is needed. A lot of times, insurance don't even pay us.
Well, hold on, Doc. No, Doc.
Yeah, we see.
Well, I mean, what would cause the insurance providers not to pay you all? I mean, is it because the code isn't written right, or?
So sometimes they focus on the code, and sometimes it could be the patient's plan. We do the eligibility check, and they're like, oh yeah, they are active and they're eligible for the care, and then after we finish providing the care, then it's something else, and we have to keep filing the appeal, and it doesn't always mean that it's gonna.
They want more information.
Yeah, so
more
we get that a
documents.
lot. We get down coded a lot, and so there's just so many factors.
So when that happens, then are you having to bill the patient?
Well, that's what the insurance would say, right? Patient's responsibility.
Oh, okay.
But then you're trying to bill people that are already paying the premium. every month.
Wow.
And it's like, how do you get that out of them? Some haven't made their deductible, which is something that I don't think is fully explained to the patients yet. I did a short video at the beginning of the year, and I sent it to my patients so they can understand how insurance works.
Because we really don't even understand.
Yeah.
Like, we just see what we pay, and then we think, okay, if I'm paying this amount, then I'm 100% covered. Right? No, that's not the case.
It's not always that way. And sometimes you have your copay, right?
Yeah.
And if you haven't met your deductible, the copay doesn't apply. You have to meet your deductible first. So what that means is you go for a visit. Maybe your doctor charges $120 for a visit, right? And if you haven't met your deductible, you have to pay the $120 before your $20 copay applies.
Wow.
Because you haven't met your deductible. Once your deductible is met, then you have to deal with either if you have a copay, or sometimes you don't have copay at all.
Or co-insurance, yeah.
Co-insurance, yes.
So what is co-insurance?
Co-insurance.
Oh, okay.
I just know it comes with a percentage, and I know it can be higher than a copay.
Part of so you have to pay a percentage too before your insurance will cover the rest. So all those things are explained. Sometimes they'll put it on the insurance cards, and sometimes it will be on the package, after they, get the insurance. But people don't really read in depth, and nobody explains this until they come to us.
Okay. I'll digress for a second. Go ahead, Kyle.
So do you believe healthcare education does enough to prepare providers for leadership, business ownership, communication, and the financial side of healthcare?
So typically, the focus of the healthcare education is to help us get our skills. Get our skills down to take care of our patients, right? So we can give them the quality care that is needed. So typically, I wouldn't necessarily say that we're prepared for that, but we learned that somehow along the way. And a lot of that I learned after I graduated. And actually recently I completed my certificate at Harvard Business School. I think it was this past June in healthcare innovation. I learned a lot.
So, Doc, let me ask you, before I ask this question, you mind if I share a story with you?
No problem.
Okay. So this was like around 2020. And I was experiencing issues like at nighttime where my food was trying to come back up, right? I didn't know what was going on. And so I had made an appointment to go see my provider. This is back in Arkansas, Little Rock, Arkansas. And so when I go see the provider and I'm sharing with them what's going on, they come back. And so now I'm not going to pronunciate this right, so you're going to have to help me, okay?
No problem.
So they came back and said, Kevin, you have gastro something, right? I thought it was a death sentence, right? Because I don't know what that word meant. And so I said, so Doc, are you saying that I'm about to die? Like, do I need to get my, affairs in order? And they go, no, they started chuckling. No, Kevin, no, it's just simply acid reflux. My question is, why do providers use these big terminology, these big words with us? And we don't, first of all, we already like nervous because we're in your space, right? Yeah. And then when providers come back and they use these big words and and here's how you know we don't know what you're talking about. It's called the universal nod, right? That means what we're saying is I'm going to pretend like I understand what you just said, but I really don't understand. Why with the big words when you're dealing with patients who's not even in that space?
So you're talking about gastroesophageal reflux disease. That's the GERD. So we'll start with that to keep us in our element, right? And then we now break things down for you. Acid reflux. So
but I had to ask. Like, had I not asked, I would have left there thinking that I'm going to die. So but the question I'm asking is, why not just dumb it down, period, when the provider is in there with the patient?
Yeah, so that's what I'm saying. We say that word, just to give the full, like the general term, right?
Okay.
But however, we're supposed to follow up with giving you the full explanation of what that means and what we're going to be doing about it. And then what you need to do to help manage it. So if you find yourself in that situation where the big words are thrown at you, you have the right to ask, what does that mean? What do I need to do after this?
Here's the problem. Most people are not going to ask. That's the problem, because we're already nervous.
Yes.
Even when we come to the appointment, I didn't even know here recent that there was a word called white coat syndrome, which elevates our blood pressure, right?
Oh, yes.
So if these things are happening with us, and I'm saying you, but I'm speaking in general, we're not going to ask, because we don't want to seem dumb.
Yeah, every provider should be explaining every of these things to their patients. So that's what I'm saying. Every provider should be explaining. But just in case you find yourself in a place where you're not being told what exactly it means, then you can ask. But every provider should be explaining things to their patients.
Now, you know what's interesting?
Breaking it down. So
right. No, right. So, and the reason I brought that up, because it's that two situations happened, but I'm just sharing with you the second one. But that's what led me to write a book for providers and healthcare professionals on better communication with their patients. So the book that I wrote it's called Credentialing Gap, because after doing some research, what I learned is that 40% of malpractice lawsuits is rarely from a prescription being prescribed. It is communication.
Communication, yes.
And the average malpractice lawsuit payout starts at $250,000. So we got some work to do.
Yeah. So if there's any provider listening to me right now, we just need to communicate more with our patients and break things down to where they can fully understand. It's not even only to understand the disease process. How about management? Because, after I tell you this is what is going on with you, so what do I do next? They need to understand the process. One thing that I pride myself of doing, even at my clinic, is after I start a patient on any new medication or any lifestyle modification, that I've given to them, I always follow up within a week. If they need to pick up medicine from the pharmacy, we follow up within a week just to make sure that they're actually taking the medicine or doing what we're asking them to do, because that actually helps us to make sure that they're actually following that plan. We're not just doing, so in case they have further questions, because sometimes they get home and they're like, oh, maybe I should have asked this, even though the doctor already told me this is what it is and this is what I need to do. But then they get home and they realize, oh, I have this type of food that I eat or something, and I just have questions. When we some don't bother calling, but when we call them back and we ask them all those things, then they can better, tell us what is going on, and we just follow up from there.
So healthcare entrepreneurship can look very attractive from the outside. What is something providers need to understand before deciding they want to open up their own practice?
Yes. So trying to open a practice is, I wouldn't necessarily say that it's not for everyone. Anyone can open up a practice. Really, there's some healthcare facilities that are owned by non-healthcare people, so you need to get your business part down. You need to understand your state regulations, the policies, and cross your T's and dot your I's. I always emphasize the importance of having a mentor. Because they can hold your hand and give you ideas. They've made some mistakes and they can actually help you grow through that. Before I started my practice, I had a mentor, and interestingly, my mentor at the time, she's MD, but she didn't actually have a practice at that time. So for you to understand that, it's not even like you have to have a mentor that has a practice.
Right.
It could be anyone that is actually just holding your hand and coaching you and guiding you, holding you accountable and making sure that you're doing the things that you need to do to get your practice started. She honed a practice at some point, but not at that point. But it still worked out, perfectly. So when you have a mentor, it gives you an idea and it really helps you to put your thoughts together. It helps you to overcome your fear, anxiety, and make you to be confident.
So, Doc, if you could go back and, prepare yourself differently before becoming a business owner in private practice, what knowledge, training, or support would you want to have earlier?
Yeah, earlier, having a mentor.
But so let me ask you this. So let's go back to having a mentor. Do you think you would accelerate it a little bit faster had your mentor also had a private practice themselves?
That was it. It didn't really matter.
Tell me why.
Yeah, it didn't matter because what we did at the time was whenever we meet, she's like, okay, this is the next thing that you need to do within next week before our next meeting, and I have to make sure I get it done. So whether she had a practice or not wasn't significant.
Okay.
Because she had the information that I needed.
Okay.
To get me going.
Okay.
Yeah. Just having the right person, that's what is important. Whether they have a practice or not, it doesn't matter.
Okay. So can someone have impressive credentials and still be unprepared for some of the real world responsibilities of healthcare?
So you have your credentials, your NP or MD, you already have your skills. So I would expect us to be prepared, for the real world. But when it comes to the business aspects of it, same thing. I don't think anyone can be over-prepared for that. I'm still learning, and we're all still going to be learning, every day. So you can be over-prepared, but always make sure that you have resources that you can always fall back to.
So how many degrees you have now?
I have my bachelor's,
Okay, that's one,
master's,
two,
and my doctorate.
So you got more degrees than a thermometer. So Doc, with having all those degrees, right? What's the one thing you feel is very important, even outside of all those degrees? What would be that one thing that would trump all those degrees, and it's a must that we have, or in your profession should have?
So outside of the degree, I want to make sure that the patients that I'm taking care of actually get the best care. I also want to ensure that the NPs that I'm training are also training other people, passing it on to others, and taking care of their patients, the best way they can as well. And at the end of it all, I can, be happy that the legacy is being passed on, and it's not just, okay, I'm training someone and they're not really carrying on the torch. We actually started with the torch, with the nursing. If you're familiar with the Nightingale, we carry the torch and we just pass it on, and we just hope that the legacy continues. Legacy.
So when I'm listening to you talk, I hear a different type of nationality. So where are you from?
Nigeria.
And so now, were you what age were you when you came here to the U.S.?
I was 23.
And you came as a student to the U.S.?
No, immigrant.
Really? Okay, so can you walk us through that story? Because I think this is about to get interesting. So you came here as an immigrant, but was the objective to come here to go to school, or you felt like you needed a different situation?
Relocate with my family.
Okay, so your whole family came
siblings, here. We came at different times, but
okay,
yeah. So that's the whole.
So when you got here at age 23, what did you what was the first thing you started doing?
So what happened really is everybody else was here except me, because I really wanted to do things for myself, in Nigeria. So I got my green card, and I was like, okay, let me come see what's happening in the U.S., right? So I got here, and my cousins and my siblings and my parents are like, you need to stay and just go to school and just, continue your education and all that. So I was like, well, it's not a bad idea. So I started at a community college, and I love the environment. I love the settings and everything. I'm like, okay, I think I'm just going to stay. So
you just going to come here and then go back home?
Yeah.
Really? Mm-hmm. So you're that connected to home then?
Yes.
How often do you go back?
Every once in a while.
Okay.
I last visited it 2 years ago.
2 years ago?
Mm-hmm.
Okay.
Yeah.
Wow. I don't know where that question came from, but I could hear the
it's worth exploring.
yeah, I could hear the dialect, and I said, okay.
Yeah.
I like that dialect.
Thank you.
Yeah. So, well, hold on, I got one more question.
Okay.
Okay.
Go ahead.
Being from Nigeria, right? Because, if you were born here in the United States, I think a lot of times we as minorities take what is available for us for granted, right? And not to say that has always been the case, because that has not always been the case. But fast forward to today, I feel like when other nationalities from other countries come here, like they really take advantage of the American dream. Was that something that you wanted to do, or it just happened that way?
Yeah, so what actually propels me to do all these things is actually inborn. That's who we are, in Nigeria. We just always we strive for the best. Okay, so coming here, it's not gonna be an option for us to get a full education. It's not gonna be an option for us not to do great. It's just something that is inborn. So we just go with the flow. So it's not really like we have that much option not to do better. So yeah, so we just go with the flow. It's just things that have been in us, is engraved in us, and we just continue.
Let's go back to communication, okay?
Okay.
How much can strong, effective communication affect a patient's trust with a healthcare provider, even when the provider is clinically excellent?
Yes, so communicating with a patient, it goes beyond, I know that they're there for their health, right? But it goes beyond that. And that's why some patients will tell you, oh, I have a good relationship with my doctor. And some will be like, oh, I want to change my doctors, because people want doctors that can actually listen to them and can answer their questions, right? I remember when I used to work in the hospital, I'll pass the medications around to my patients. And one of the patients that told me one day so I was explaining to her, this is your amlodipine for blood pressure. This is this for this. And then she was like, oh, just give me all the medicines. I trust you. So when you hear that from a patient, it makes you really think about what you're doing. Like your patient trusts you so much. So every word that comes out of our mouth, they believe.
So when we talk about building a legacy in healthcare, what do you believe healthcare professionals should be doing today to make sure they are not only clinically competent, but truly prepared to lead, communicate, serve patients, and build something sustainable?
Keep going. Well, I don't want to say go with the flow, but yeah, keep educating yourself. I mentioned how I just got a certificate recently. You just have to keep educating yourself, because there's a lot to learn out there. We can't just do what we've been doing, in the past. And also, when it comes to the people that works with you as well, it's not only, okay, you have a medical assistant, for example, you need to encourage them, to do better for themselves as well, not just get stuck in one place, because as you're advancing, you're also encouraging them to do the same. And whatever you can do in the community, for example, I teach a whole bunch of teenagers in my church. I always encourage them to do better, for themselves. And even with the healthcare, I'm actually excited about, seeing their growth, contrary to what we see out there with all this internet content creation and all those things, technology, and people just want to have businesses and stuff. I'm seeing that these young people are actually still interested in going to medical school. Healthcare field is actually a joy for me, because that means we have people to take care of us, right? So there's still, a lot of people out there that really wants to do great, even if it's not in the medical field or healthcare field. Anything that people are trying to do, I'm always trying to encourage people and just support them in any way that I can.
So Doc, speaking of that, it's obvious that there's a huge gap when it comes to blacks and white coats, right? What can healthcare providers, what can the community do to encourage more people of color to become physicians, to become dentists? Because again, and this is when I say this is no disrespect, okay? At the end of the day, we identify with people who look like us. So, whether you're Caucasian, whether you are Indian, whether you are Arabic, we typically identify with people who look like us. But the problem is there's not enough people who look like us who are wearing white coats. And when I mean white coats, I mean physicians. What can we do? It's obvious I'm passionate about this, right? But what can we do to increase the awareness?
So yeah, that's part of what I do. Like I said, in my community, I'm really not trying to mention names, but I know there's this black man in white coats.
I've seen that. Yeah, I've seen that.
I've actually attended the program with my kids and some other kids at church as well. So that is there, and they're really mentoring. They do Zoom calls, like maybe sometimes they do it every week, and they just put them in the community. They have people in medical school coming to talk to them and all that. And recently, my son attended it's called SPEP at Texas A&M here in Dallas. And what they're doing is to groom future students that wants to become dentists. So the moment I heard about that, I informed my community, and I was like, if you want to be a dentist, if I were your parents, I would just go donate you to them so they can just train you. They'll help you, even the process of getting, even with your SAT and everything, get you ready for the dental program. So we have resources like that. UT Southwestern has a good program as well. So Black people are out there. We might not know of all this, might not know all this information, but they're definitely out there and they're doing a great job. So as a community, we can always start something as well. There's always room,
Right.
to support the growth of our next generation.
I have no more questions.
Well, I got one more. So, Doc, who is your ideal referral partner? Like, who would you, what type of provider would you like to receive a referral from?
You mean like the specialists?
I mean, so like you're
primary care.
Right. So who would be a good provider that could refer you a patient?
So specialists do.
Okay,
So
what
for
type of
example,
specialist?
The GI doctors, when they have
Okay.
patients, they don't have PCPs.
No, what do GI stand for? Like, is that
gastro-
GI
I'm
Joe?
sorry.
See that? Yeah. Okay.
Now you
Okay.
caught me.
Okay. Yeah.
Gastro.
Ah, okay. 'Cause I thought you were talking about
Thank you,
GI
Doctor.
Joe, the real American hero. Okay. All right. So gastro. Okay.
Gastro, ophthalmologists, cardiologists, urologists,
Okay.
hematologists.
All right. So
just
let's
name them.
Okay.
So the blood doctor.
There we are. Okay. Okay. So the blood doctor. That's the hematology.
Yes.
Okay.
The eye doctor.
Ophthalmologist.
Ophthalmologist.
Okay.
Okay, the urologist, that's the take care of the
That's the male doctor.
The male, yeah, take care of all that.
Yeah.
And female too, because
Really?
yeah, the bladder and stuff.
Okay.
And then
See, I'm learning.
the gynecologist, of course, that's
Okay.
strictly for the
Women.
female.
Okay.
Yes, yeah, for the women, and also the orthopedics, that's the joints.
Okay.
So any of those special dermatologists, because some patients just, a lot of times they need referrals. So that's another thing, to see the specialist, right? And some don't. So for those that don't need referrals, if they find themselves in that, with the specialist, then they will recommend that you need to see a primary care doctor, of course, to take care of other things, because we are only taking care of this part of your body.
Okay.
Yeah.
So what I want you to do, Doc, that camera, the third camera in front of you, I want you to look in that camera, and I want you to talk to your ideal patient. And then once you talk to your ideal patient, I want you to talk to your ideal referral partner and why they should, send that referral to you.
All right. So if you're out there and you need a compassionate provider to take care of your needs from head to toe, I always emphasize head to toe, that would be me. Not only do I provide care for your annual physical, of course, doing your assessment, taking care of your blood work, checking all that. I also do pap smears and all that, and also for chronic care management. you have hypertension, diabetes, high cholesterol, just anything of sort. And I also do a lot. I do a lot with women with menopause, menopausal symptoms as well. And another thing that I do with chronic care management is for people with high blood pressure and diabetes. The care goes beyond the clinic. When you get home, we give you devices, if you qualify for it, where you check your blood sugar, blood pressure at home, and we see the numbers in the clinic. And then we actually follow up with you on that, give you a call if there is a need for that. So by the time you come for your next visit, we have an idea of what is going on with you. And then, so that's what I do. And once I get your blood work, I don't treat it like a number. I actually sit with you. I do a lot of telemedicine with that, or even phone call, to explain what each of your numbers mean and what we need to do to follow up. And then for the providers out there, if you have any patients that need any of this care from any of the specialists, the gastroenterologists, the urologists, dermatologists, ophthalmologists, the gynecologists. So, and if you have any of your patients that needs a provider, I'm here for them. Dr. Olubumi Awe in Grand Prairie, Texas, 830 Mayfield Road, Suite 100. I'm always available for your patients.